Hey everyone, and welcome. Today, we are going to get right into it and break down everything you need to know about kidney stones. So whether you're dealing with some weird symptoms right now or you just want to know more, think of this as your complete guide. You know, it so often starts just like this, with a sharp, nagging pain in your back or side that you just can't seem to shake. It might come and go, but it's a feeling that's really hard to ignore. If any of that sounds familiar, you are definitely in the right place to get some answers. So, what exactly are we even talking about here? Well, in the simplest terms, kidney stones are basically little hard deposits. Think of them as tiny, unwanted rocks that build up inside your kidneys, and they're made from minerals and salts that are already in your urine. Okay, so to solve any mystery, you've got to look for the clues first, right? So let's start with the early warning signs your body might be trying to send you. Now, what's really interesting here is just how subtle these signs can be when they first start. That pain in your back or side, it isn't always there. It can totally come and go. You might also notice a burning feeling when you go to the bathroom or see that your urine looks kind of cloudy, maybe even a little pinkish. Those are the first crucial clues. So, how do these painful little things even form in the first place? It's actually a pretty fascinating step-by-step process. It really all boils down to three main stages. First up, you got a buildup of extra minerals, like calcium, in your urine. Then, and this is a big one, if you're dehydrated, those minerals start to form these sharp little crystals. And finally, those tiny crystals start sticking to each other, clumping together and growing bigger and bigger, until bam, you've got a solid stone. And what's wild is that not all stones are created equal. Think about it this way. What you eat can literally build these stones inside you. The most common type are calcium stones, and they're very often linked to your diet. But you can also get uric acid stones, which tend to show up in people who eat a lot of protein and don't drink enough water. Figuring out the type is so important for stopping them from coming back. So once you think you might have a stone, the very next step is getting it confirmed. And this is where modern medical imaging is an absolute game changer. Here is the bottom line. You just can't treat what you can't see. Your doctor needs to know exactly where that stone is, and just as important, how big it is. That's the key to making a plan. So how do they actually see it? Well, the two main tools in the toolbox are sonography, which you probably know as an ultrasound, and CT scans. Both of these give a really clear picture of what's going on inside your kidneys, which lets them make a super precise diagnosis. You know, when it comes to kidney stones, size is everything. If a stone is small enough, your doctor might just tell you to drink a ton of water and give it time to pass on its own. But the large ones, that's a whole different story. They can get stuck, cause major blockages, and lead to some pretty severe pain. And that's when you really need medical help. Okay, so what happens when just drinking water and waiting isn't cutting it? Let's take a look at the modern tools doctors have to get you some relief. And the really good news here is that you don't just have to suffer through the pain. If a stone is causing real problems, there are some incredibly effective medical procedures out there that can provide relief and get rid of that blockage. So treatment usually falls into one of four buckets. You've got everything from non-invasive procedures where they don't have to make any cuts at all to minimally invasive surgeries. A really popular modern option is using a laser to literally turn the stones into fine dust that you can just pass easily. And of course, for the really tough cases, traditional surgery is still a very reliable option. But of course, the absolute best treatment is just not getting them in the first place, right? So let's talk about what you can do to stop stones before they even start. Okay, this is where you have the most power. I mean it. The food you eat, how much water you drink, these everyday habits are your single biggest weapon in preventing stones from ever coming back. It's all about making proactive choices. All right, speaking of what to drink, we have to tackle a really common myth. I'm sure you've heard this one before. The idea that drinking a bunch of beer can help you flush out a kidney stone. So, is there any truth to it? Let's go ahead and separate the myth from the actual medical facts. So here's the deal. The myth is that beer is some kind of miracle cure. The fact is, while, yeah, the fluid in beer will make you pee more, it also has stuff in it that can actually increase your risk of forming stones down the road. So, what's the final verdict? Your best, safest, and most effective bet is always just plain old water. Simple as that. Understanding all of this is great, but getting the right kind of care from the right person, well, that's what really matters. So let's talk about how to find an expert who can guide you. You know, when you're in that much pain, you want more than just skill. You want compassion. This person's experience really shows how important it is to find care that's not just expert level, but also supportive and efficient. In a field like this, experience is just about everything. So when you see a number like 30 plus, what does that actually mean? Well, it represents decades and decades of focused practice. That number, it represents the deep expertise you find in specialists like Dr. Manohar CS. We're talking about an entire career dedicated to treating these exact conditions. And that level of focus is precisely what you should be looking for when you're choosing a doctor to help you. So let's end with this thought. The little choices you make every single day, especially what you eat and drink, they have a massive impact on your health tomorrow. The power to prevent this kind of pain is really, truly in your hands. The only question is, are you ready to make that change?